Hi, hello, this is Dr. Srinivas Bijay, consultant medical oncologist. So in this video, we will know more about cervical cancer. So cervical cancer, which is the commonest cancer after the breast cancer occurring in women. So usually we see most commonly in the age group of after 50 years, after 60 years, once their menstrual cycles have stopped. So what are the commonest symptoms? The post-menopausal bleeding. Once the woman attains menopause or menstrual cycle stops, then after a few years of age, if they started having the bleeding per vagina, so then usually that is a symptom of cervical cancer. Most commonest risk factor for cervical cancer is multiple sexual partners, unhygienicity. So there are so many other factors are involved. So what are the causes? What causes the cervical cancer is the human papilloma virus. So it is an infection. Almost 95 to 99% is caused by the human papilloma virus infection. So it is acquired in the earlier age of their life, maybe around 30 to 40 years, and after another 30 years later, the infection shows up in the form of cancer. So this is one of the example of vaccine preventable cancer because it is caused by the infection. So you treat the infection at the earlier stage, so the cancer can be prevented in their lifetime. So that is what the example of vaccine preventable cancer. So other vaccine preventable cancers are liver cancers, which is caused by the hepatitis B virus, hepatitis C virus. We have a vaccine for this, and if we give that, the liver cancer also can be prevented. So we will more go about in the vaccination of this HPV infection. So when we have to give, at what age it should be given. So as per the literature, as per the recommendation, now the vaccination is available all over the world, all over in India also it is available in most of the hospitals and in our nearest medical centers it is available. So the most recommended age for the girls is within from 9 years to 16 years of age. So if it is given in this age, it is to be given at the gap of 1 month, at least two doses, and if it is after 16 years of age up to 17-18 years, at least 3 doses needs to be given. Suppose it is given at this age, 9 to 16 years, before the first sexual exposure, then the effectiveness of this cancer is almost 100%. That particular individual, that particular woman having the cervical cancer in their lifetime is almost zero if it is given in this age group. So the commonest question comes whether after the age of the first sexual exposure, maybe around 20 years, after 30 years, whether if vaccine is taken, whether it is going to be preventable. Yes, this depends upon the effectiveness of the tumor. Effectiveness will comes down maybe around 30 to 40%, 50%. Effectiveness is not that much when after the age of 30 or 40 years of age. But still, there is no harm in taking the vaccination. So people can go for vaccination even at the age of 30 or 40 years of age. So one more aspect of prevention of this cervical cancer is pap smear. So I was talking about screening mammogram for the prevention of breast cancer, for early detection of breast cancer. The pap smear is also similar to early detection of cervical cancer. So after the age of 50 years, once the menopause, once the menstrual cycle stops, the woman can undergo pap smear once in a year or once in 2 years. It is just as the gynecologist or the woman doctor will take a smear from their vagina, and they will test in the microscope, and they are able to identify whether cancer cells are there in that or not. So if these cancers are detected in that stage, we can be cured, or it can cured for their lifetime. So it is not a very early stage it will detect pap smear. So pap smear and vaccination are the gold standards for prevention of the cervical cancer. So if you want to know more about this cervical cancer, please get back to us and we will meet in our next video. Thank you.